So, good morning, everyone. Good afternoon, good evening for wherever part of the world you're listening to us from. This morning, I'm very excited. Well, first of all, happy new month to you. This is an exciting month to come into. We are almost wrapping up the year. And I'm very excited this morning because for the month of May, I'm starting off with someone who I think she has a very unique journey because tell me why someone will move from one industry to come to another industry to come and solve for healthcare. And this is very exciting to me. And that's part of what we do in the HSB podcast to really spotlight leaders and people who are really leading change in healthcare. And I'm very excited this morning to introduce you to Isimeme, Isimeme Ughele, who has been working silently behind the scenes in healthcare, and she's going to be telling us a little bit about herself and what she's doing with her organization, GivingSphere Charity in Nigeria. So I'll allow Isimeme to quickly introduce herself to us. Hi,
Thank
Isimeme. Can we
you.
get to meet you?
Hi,
Yeah.
Zine. Thank you so much. And first of all, just well done on what you're doing. It's so amazing. I had a serendipitous meeting of your podcast and I've just been hooked since then. So just well done. So yeah, my name is Isimeme Ughele. I'm a procurement and supply chain leader working in a company, a multinational telecoms company. And I lead a team of about 15 sourcing managers across 26 countries in Africa, and I'm handling a portfolio of about $40 million. So that's my day job.
Wow.
But then on
Wow.
top of that, I'm also founder of GivingSphere Charity Foundation. And GivingSphere Charity is a charity that is contributing to zero poverty and equitable healthcare access by addressing the out-of-pocket payment crisis that exists in Nigeria. So our work lies at the intersection of healthcare and poverty. And it's been 8 years and counting. And we've had, the good fortune and opportunity to impact, so many families across Nigeria. So yeah, that's what we do.
Wow, wow, wow. When you just mentioned the portfolio, you're actually managing the people you're managing, the industry you're
Yeah.
working in. I'm like, no, this lady is definitely super, super amazing. And I'm really, really glad to have met you as Isimeme. You're inspiring,
Likewise.
you are a daring leader. I think you're also like one of the top people in your company. I'm like, hey, she's got through this. But I'm very, very really curious to know because I always ask my, guests their whys, right? Because I feel
Mm,
like knowing why people do things is very, very important. And, it helps us to really know the cause and how we can plug into the positive vision and how we can plug into the vision. I
mm,
want to know why you chose to start Giving Sphere, why you chose to
mm.
do something in healthcare. You've mentioned that you have a background in telecommunication and you're managing teams. Why should you still be interested in solving something? So can you take us back to why you started something in healthcare?
Yeah, okay. I mean, I guess I'll take you back to the very, very beginning. I like to think that I was a precociously empathetic child, right? So from a very young age, I was just kind of conscious and aware of the inequality that exists in the world and, just moved, by that. And so one of my earliest memories actually is from when in primary school. So I grew up in a middle class family in Nigeria. That meant, I went to a very good primary school. And then I had my parents would drop me off. So my father would drive me to school. And I remember just sitting at the back seat of the car one day and I saw a child who was begging, So the little child came by the window, was knocking on the window and sort of begging for alms. And I just was so moved by why is she not in school? Why is she not on her way to school like me? And I think I even asked my dad, like, why is this happening? Out money to beggars as we had them in Nigeria. And Nigeria, but almost 45% of people live below the poverty line. So it was very, very sort of obvious in our face the inequality that existed. And so two things struck me from that encounter. It was first that there is inequality in the world and there's someone that is different from me. That stayed with me. But also that you could take an action. I could take an
Yeah.
action by giving money. So then I made a little commitment in my mind that okay, so if it is about giving money, then I could also try to do that. So I remember that I would even save my lunch money sometimes. And just the joy on their face when you give them, it's just almost palpable, right? So that really struck me. And so I'd been making, small contributions here and there, just from that consciousness. And then fast forward to secondary school, university as well. I was always volunteering for things, just trying to, support in any way I can. But then also the additional pivotal moment was when I moved back to Nigeria. So I had my university education in the UK, and then I moved back to Nigeria. And then, so another small story is that I'm Catholic. And so I go to the Catholic church. And in the Catholic church, there is an arm dedicated for charity, actually, which is called the Society of St. Vincent de Paul. And they usually help the poor. So I felt as well that, if I'm very intentional and conscious about helping, then I should join that society. So I joined that society, and we would meet all sorts of people. So people who needed money for rent, people who needed money for school fees, pregnant women who couldn't pay their medical bills, people who were ill. We met all sorts, and we would, get money from people in the church, or, try to raise funds to help these people. But also just being there and sitting in those meetings and meeting all sorts of people, it struck me that actually it's only the people who are alive and healthy that can beg, as it were. So just seeing the helplessness of people being ill and not
Mm,
being able to do anything, I
yeah.
just felt that, wow, I needed to do something about this somehow. I just felt a sense of responsibility. And then as well, you would see people begging for as little then as 5,000 naira, comparatively, 5,000 naira is what somebody needs to pay for a hospital, consultation to get the treatment they need. And you just couldn't get it. So it just struck me then. And since then I started making, so little efforts to contribute. So that's the backstory. Yeah.
Wow, definitely you are very altruistic and someone who has a great heart to do great things. And I think that's very important to highlight because oftentimes people that I have met who are doing great things in healthcare always have that story that,
Mm,
pushes them to continue to do more. And your story of even just observing what's happening in the system, right? You
mm,
see, you observe your observation of it, and that's why this podcast is called the system series because we want people
mm.
who have seen the system, who have understood the system, to really come and say, "Oh, this is what I've seen. These are the gaps I saw, and this is why I'm feeling this need." And so, thank you for highlighting that story. You said something that really struck me. You said you can take an action, and I think that's something that we need to spotlight. Oftentimes we feel like it's just the government, it's just some
Indeed.
highfalutin philanthropy or a
Indeed.
donor or somebody outside the country that can come in to take an action. But you started from where you are, from saving your offerings, which is
Yep.
actually very funny. But for doing that, it's really struck me that everyone can take an action today. Just this week, I came across a video on Instagram about a
Mm,
woman who was lamenting that she lost her sister because she couldn't pay
mm.
15,000 naira bill in the
Yeah.
hospital. Actually trending on Instagram right now. And it really made me appreciate what you're doing in Giving Sphere. So can you
Yes.
tell us more about how your organization has evolved and what you guys are doing, to support,
Mm.
people like these who are vulnerable and don't have the means to take care of themselves.
Yeah. No, thank you. And I think, this 15,000 naira story, with this woman is more
Mm,
common than you think, or more common than we think and we know. And so, and I said the backstory of how, like, I had that empathy towards taking an action. But then what
yeah.
led to, founding and creating Giving Sphere was an encounter actually with an 18-month-old boy who had been diagnosed with cancer. So
Wow.
it was bad enough that this boy had cancer, but then at the time, his parents needed 18,000 naira to
Mm,
buy
wow.
blood pints that were needed for blood transfusion for him. And they could not afford this 18,000 naira. And I said, I mean, to typical working class Nigerians back in the day, I don't know about now because,
Mm,
I'm kind of out of Nigeria now, but, that was
mhm.
money that you would use to buy maybe shawarma or pizza or something.
Yeah.
And then this is the money that somebody needed to
Just
save the
save a
life
life.
of the baby. So I mean, I knew that I could do, I felt that I could do something about it. And then it also struck me that I could also reach out to people to help.
Mm,
So then I
mm,
reached out to a couple of friends and family and I said, there's this little boy that has cancer. They need 18,000 naira. And what I need from you is just 1,000 naira each. I don't need more
mhm.
than 1,000. I just give me 1,000 naira. And I went with that in the mindset of that if 100 people contribute 1,000 naira, that's 100,000 naira that can make a difference. And a bit of
Yeah.
backstory to that is that, again, in Nigeria, where poverty is very prevalent. People are somehow inundated by so many requests,
Mm,
either being requested by people on the road or family members, the black tax, or
pressure.
a church is asking for money for offering. So people are just inundated with so many things, right? So I just felt okay, rather than go to people with a problem of somebody needs 20,000 naira or 50,000 naira and they have to think about it, I said, just give me 1,000 naira. Then, so
Mm,
everyone, contributed 1,000 naira each, and we're able to contribute to this, little boy's, blood transfusion that he needs. So they were able to buy the blood and they were able to successfully have the transfusion. And then, I gave feedback to my friends and family, after we made the donation, and they said, wow, so you mean this is what my 1,000 naira did? Okay, when next you're doing it again, let me know. And so that was
mm,
what created the foundation for GivingSphere and our major initiative called the 1K Helpline, which is basically
mm.
1,000 naira to help. And so consistently every month for the past 8 years, we've been collating funds like that from through donors to pay for medical bills for, patients at risk in Nigeria. So we've supported people that had cancer. We have supported even children like, Ismail, the little boy that had cancer. We have helped, pay for mothers, cesarean section, sickle cell warriors. We've done so much, and our impact has reached over 1,500 people and counting, and across 6 states in Nigeria. So we've, it primarily started in Lagos, but then we've, had to support, other states. Yeah, that's
My God, just from your heart to help, you've touched 1,500 lives. That's phenomenal. We should all clap for you because yes, that's actually really phenomenal. Great job. And really want to thank for people because you're not doing it for profit. This is a
yes,
non-profit, out just from a place of your heart and just
correct.
seeing a gap that you can feel. And I go back to that, what you had said. You can take an action. Everyone can take an action. 1,000 naira supporting Isimeme's giving fair charity can actually save a life. And
Thank you.
this is
Yes.
actually I remember even back then when I was in Nigeria, getting phone calls from friends. Oh, my dad is in the hospital. Please, can you lend me 15K? Like
Yeah.
most of the times, I don't. I try. I give, but not the full capacity of what they're asking for. So
Correct.
imagine if 1,000 naira can actually save a life.
Yeah.
For
Which is the
context, for
case.
those who are Mhm. For context, for those who are not Nigerians, 1,000 Nigerian naira is less than $1 right now.
Correct.
Just you supporting a CMMA with just $1, $2 per month can actually help save a life. And I think this is definitely what's spotlighting for people to know that, people are actually doing the work, right? People are actually helping to save life. And with more support, we can do this at scale because right now she's touched 15,000 lives in 6 states in just 8 years and her just doing this on a small scale. So imagine if entrusting, Isimeme's giving spare charity with good funding and support. Imagine how much more lives she will touch. So I really, really want to thank you for the work you're doing in this space. I think
Thank you.
oftentimes we don't see people at the back end because we're always looking
Mm.
at the big names. But people like you are heroes, who have saved 1,000. Imagine those people that have been dead, but you have saved
Yeah.
life. And I want to see you see it in that light.
Yeah. No, thank you so much. Thank you. It's sometimes it feels small even, but we're always encouraged and empowered by, even just saving, just helping one life,
Mm,
is
mhm.
it goes a long way. Yeah.
Yeah. So I know you've shared a couple of stories about the cancer patient and all.
Yeah.
What's that one memorable or defining story that you've seen on the field, that you can look back and that keeps you going and say, hey, see, Meme, I must keep doing this. I need to continue. So what's that story that, you can remember right now? If you
Yeah.
don't
Ooh.
remember,
No, I mean, honestly, and I'm not even trying to exaggerate, every single impact, every single outreach we have done has been
yeah.
so touching. Just last month being April, we helped, mothers in Lagos Island Maternity Hospital. So these were mothers who had given birth and they needed to pay their medical bills. And then we also supported the hospital with some equipment, baby monitors, scales, those kind of equipment that could help, just not just one person, but also multiple people, right?
Mm,
But also because I wasn't present and my team was handling this. And they had said that one woman who we helped pay her bill was 400,000 naira. So I
mm-hmm.
guess that's the equivalent of what, maybe $400 or something. They said she literally fell on the floor, even with the baby.
My God.
And so it was like, she fell on the floor out of shock. Like, what? Maybe she had prayed that morning for money to appear from somewhere. And then we just
Yeah.
came and, just out of that, her problems, as it were over. So she literally fell on the floor. People had to be checking that. I hope the baby is okay. That it's okay. just because we're able to sort out her bill, So that's just even up to last month. There's so many. I remember one that even really moved me as well. And we had supported some elderly citizens in Kwara State. They needed
Mm.
cataract surgery. So we worked with them. We, worked with the hospital in Kwara State to enable them have this eye correcting cataract surgery. And the next day, they insisted, actually, these old people insisted on sending videos to us to say thank you. And one of the women, she speaks Yoruba. I understand Yoruba because my mom is Yoruba, and she was, saying a lot of very deep prayers, saying that, Ọlọ́run wa, your Ashiri, your Nibo, she was just saying all sorts of prayers. And I said, I just burst out crying. I just burst out crying. Like, this is a lot, So every single person that we help inspires us to do even more. Sometimes we feel that we haven't even done enough. Sometimes, as a result of the funds collated, we have to make tough decisions on who should benefit from this care and so on. But every single one keeps us going, honestly. Yeah.
Wow, definitely. I think that's something that will make me emotional myself, to just see someone
Yeah.
who is vulnerable, not really because you are doing it from a place because you want to get that superpower, but just helping someone. Like, it's hard to find people who are willing to help in these times. And I think, it's very, very important that we spotlight people like you to see still great people who are actually like using their network, their funds, their time, their
Mm.
knowledge, because you're not a small woman, you are a leader, you're a global procurement
So-
woman, and you are industry,
yeah.
but still looking back, and I think this is a call for all diasporans to also
Mm.
look back. There's always, like I will say it again, you can take an action today. Don't think
Yeah.
because you have $1 million or you wait for $1,000. Just even
Yeah.
supporting and partnering with people like Isimeme's GivingSphere charity, I think is very, very important. So yeah, I think we've come to a point where, definitely last year we saw a lot of shift in global funding for charity, philanthropic work in healthcare, the funding cut for USAID in terms of like
Mm.
their care for HIV patients and all of these things have made healthcare systems really vulnerable. And, patients who typically would go to the hospital to get drugs and, for free no longer have those luxury. I think, it's worth thinking because now, we have a gap, right?
Yes.
And going back to the theme of this podcast, which is right, can digitization solve the transparency crisis in medical aid? Because one of the things that we realize the US government and a lot of governments, both in the UK, are saying is that this lack of transparency, this lack of, clarity in terms of how much we give and how much actually translates to the impacts we are seeing on the ground. So my question to you is that question: can
Mm.
digitization solve the transparency crisis in medical aid? Yeah.
Yeah, no, I mean, just also piggybacking of what you said, I was listening to a podcast just last week, and they were talking about again this funding that has been cut, and the impact on Africa particularly, and with things like HIV and so on, and just the ripple effect of that, saying that now there could potentially be an increase in HIV patients that we have. People have sexually transmitted diseases like chlamydia, for example, then there is a ripple effect and so on. And I was honestly just afraid. I was just scared that, this is scary. And I think even a stronger call to action for me is what more can we do?
Mm.
But then also just back to your question on, solving the transparency crisis. So the transparency crisis to me, I see it in like two distinct parts or maybe even three. The first one being, the actual data that is available. So today, especially in Nigeria at least, we have the National Bureau of Statistics, but then we also rely heavily on, data from international organizations like WHO and
Mm.
so on. And, sometimes I often wonder, especially, with my being on the field and seeing just how the scale of and the magnitude of the problem is, I often wonder about, the statistics and, actually just seeing the real figure. So there is some sort of, I see that in the aspect of like the data availability, you know, and then also like funding. Where does the funding actually go? So a
Yes.
lot of people are skeptical. A lot of people have been burned by charities and charity presenting organizations for where the
Yes.
funding goes, and that has also impacted people's ability to give or people's willingness to give. So I think digitization goes a long way. I think it has been very instrumental for GivingSphere, particularly because this started off really through WhatsApp messages and WhatsApp communication. So just the ability to even communicate to a wider group and to have an extended reach, I think that that's been really instrumental with our work. Then there's also in terms of actually transparency. So I remember when I first started, because I am someone who I'm very big on integrity and I have this very big sense of responsibility. So as people were trusting me with their money, I even had to over explain how I was using it just to make it clear that please, I'm not using your money. So at some
Yes.
point, I had to even create a dedicated personal bank account for it. Obviously, this was
Mm,
before, we grew into a charity that is more structured now. But at the time, I had a dedicated bank account. I made the bank statements easily available to anybody who wanted to see. Every time we make an outreach, I would give an actual impact report of how the money was used. And thanks again to digital technology, we were able to, have this. And just also things like, using a bank account for transfer, especially in Nigeria, the banking system has really evolved where you can make transfers very easily. So that traceability helps with transparency and the ability for people to, give more. So I think it's really made a significant impact into it, and there's so much more that can be done.
I think I love the fact that you're a supply chain, experts, procurement, traceability. I can see the the link. Because obviously that's your expertise. You might not have thought about it that way, but even your
Mm,
expertise in procurement and supply chain is probably very crucial in what you're doing, because now we have to think we're getting it from the source, trying to get to
yes.
the consumer. What are the bottlenecks? What are the things we need to do to make it easier? So definitely, I really, really
Yeah.
appreciate all you said
Yeah.
about, about this. I want to spotlight a book that I read some years back,
Mm,
and it's by Bayo Olukombi. I'm probably going to send him this because he wrote a
okay.
book some years back on the future is shared, right? And how
Mm,
important, we need to begin to innovate with this in mind. Because
mm,
obviously right now with a lot of things, we have overshare, we have GoFundMe, we have,
mhm,
a lot of things now. People now pull resources because that is the business model in itself, the shared future where everybody wants to be a part of something big, right? I think model is something that we need to really, really amplify more. We've not done a lot of great job in we've not done a great job per se in amplifying that concept of the future is shared, because truth is we all need each other. We are social animals. We all need
yeah.
somebody. We need to help us. We need somebody to coordinate us. And even the concept of the black tax is itself
Mm,
limiting. But if we know that my 1,000 naira, my 500 naira can actually help save a life, I think just amplifying that story and telling that story in the right way can actually help, help people to see to the vision of what you're doing. You also said something that really struck me about you also using low cost model like WhatsApp, right, to start.
mm,
Because often that thing is one highfalutin, and even digitization doesn't have to be really, really, highfalutin. It can be something really small and then you scale as you grow. But definitely, I love what you said about transparency and,
yeah.
how it's very, very important, because I think that's something that a lot of Africans are afraid of. You see somebody on Instagram crying today and say,
Yes.
"Oh, that's the example of for lack of a
Yeah.
better one, somebody coming to claim I have cancer for stage
Yeah.
4 as something as serious as that." And at the
Yeah.
end of the day, that is a scam, right?
Yeah.
So if we have a third party who is actually in the loop to say, okay, this person actually has, we've seen the report, we've seen people give to this cause, rather than people just, because that trust is something that people are losing. That anybody can come on Facebook
Indeed.
and cry and say, "Hey, I have this disease." So how do you see, GivingSphere playing in that space if there is anybody who is willing to support your cause? Like, what's the process, or what's the process like for maybe an audience or someone who might listen to this podcast?
Mm,
How do they see through that process? How do they be a part of this?
mm,
How do they interact with giving without even, some people might not want to be known, right?
mm.
How have you leveraged technology or digitization to make it anonymous, or someone just wants to give to a cause, or is it something you're still working towards? Like,
Mm.
okay, if there's a patient who needs care for cancer, and how have you managed that process?
Yeah, honestly, it's still something that we're working on, something that I also dream of. In fact, I have so many big dreams about how, I sort of stumbled into this field and I see so
Mm,
much opportunity and potential. I actually dream of a sort of system where, you can connect potential donors, with patients and hospitals, and just, creating that very clear red thread for people through like a gym together, and, gradually trying to see how I can work towards that. But what we do
Mm,
now is we primarily work with social healthcare workers in hospitals. So at every of the government hospital, I have built a network of social workers. I connect with them right now virtually, but I have a team that is, also handling that on ground. And when I was back in Lagos, and every opportunity I get in Lagos, we go to the hospitals, we work with the
mhm.
social workers, we actually see that the cases are valid, and we make the payment on the spot. And, also with technology like WhatsApp and social media, we're able to also have, a wider reach towards the cause. So yeah, that's how I see it.
Wow, that's amazing. It was through you that I got to realize that we have offices of social workers, right? Or
Oh,
healthcare
yeah.
workers who are, actually in need of help. And oftentimes we don't see this, we don't see the need. So, for example, my organization
Mm,
recently went to for a maternal health outreach in 2 states, and we were able
okay.
to the social health worker. And it told us we need this. We actually need one of them said they need a fetal dopa, right?
Yeah.
And the fetal
Yeah.
dopa is very, very cheap device that actually
Yeah.
can
We
help save
we donated
life.
that recently as well, just last month. Yeah. Yeah.
Yeah, and so when my team were telling me about that, I was like, okay, so I didn't realize that
The
we can
extent.
actually just just with your pizza money or your money used to
Yeah.
drink, I take ice cream can actually
Yeah.
help save a baby's life. So I
Yeah.
really appreciate you spotlighting that. So you have a network of social health workers across Nigeria. What do they do in that office? If you could tell us a little bit, like
So
is it an office that needs help or collates help or yeah.
yeah, so we actually do, and it's always surprising to people, a lot of people as well, that it exists. I think that not only does it exist, they're actually very up and doing, as we would say in Nigeria. They're very, very serious about their job. So their primary responsibility is to connect, indigent patients, as they're called, with,
Mm-hmm.
funding, basically. So
Mm,
they take hold of, case files of individuals or people in the hospital, and they try to ensure that, they the patients are treated. So
mm,
a lot of times when we engage with them, most of the times they have a list, of
mm,
actually the patients who in the hospital need, aid. And because they are primarily there, most of the time they are stationed in the hospital, they are able to also give a brief assessment of the patient. Oh, this one, she came in yesterday, her family is of this type of profile, she actually really needs the money. Another person can be, oh, this one, they have said that they are going to get money from somewhere. So they are able to also help with the sort of
yeah.
urgency, the balancing of the urgency and the need. And I see them as, actually very, very, very serious, and important stakeholders in the whole ecosystem. Yes.
Yeah, I think it's very, very important to highlight that so people can see that you are not
Yes.
just actually going to the street to look for people. There is a clear demand. There's actually
Yes.
an overwhelming demand for help in terms of like social welfare for healthcare workers.
Yeah.
And if we totally depend on the government alone, we will not move the needle. Going back
Yeah.
again to what Isimeme had said, you can take an action. 500 naira, the $2, the $10 can actually help save someone's life today.
Yeah.
So thank you so much for spotlighting that, Isimeme. I really, really appreciate the way this conversation is going and how we've talked, how you've been able to lead change in this space in even with the scarce resources that you have to
Mm.
save lives, over 1,500 lives and counting. So my question to you now is like, so what are those lessons you've learned on the field? Because obviously there are
Mm.
sometimes it's not even like everything is perfect, particularly in terms of like working with other stakeholders, right?
Mm.
In terms of partnerships, collaboration with government or institution, what would you say you wish worked better, right? What would you say you wish to make the system stronger to help people like you who are trying to do good, because oftentimes I believe there is maybe there might not be 100% risk. There is a risk per se in terms of like some sort of like doing charity. I don't know about Nigeria, but I know in the
Mm.
US it's something that is encouraged. People are encouraged to be philanthropic and to give, and sometimes give them tax break. But in Nigeria, who cares? If they give you tax, I don't know. Maybe they'll give you thank you, and you're doing it from a place, not from a place because you want to receive accolades. But
Mm.
what would you say you wish worked better to make your work easier for you?
Mm. Wow. Wow. It's a lot of things. It's a lot of things. And this is also, I say, the beauty of, the human interface ultimately, because also there's so
Mm-hmm.
much technology can do, but then there's also social nuances and the context that need to be taken into consideration. So was it 2 years ago, we had an outreach in Abuja where we wanted to have a vaccination campaign or vaccination outreach within a local community. I think it was Guape local community. And we wanted to administer vaccines and preventative health care to the community. This was, of course, supported by, so we had collaborated with another charity and we had like medical personnel and so on that would administer. So as part of our community assessment, we work with, the community leaders that are in these communities. And so when we had started engaging with the community leader, he had said actually the way we wanted to distribute the vaccines and the way we wanted to administer the program should go based on hierarchy and social status or social importance in the community rather than, the most vulnerable or anything else. And I say vulnerable with, sort of sense of responsibility. So you can imagine us coming very enthusiastic. We want to help. And, a community leader is saying, no, my organ must receive it first. My wife must receive it first, that kind of thing. So
Sort
there's a
of
critical,
entitlement, right? Is it? Would you say it's entitlement, or how you put it?
not so much entitlement. It's just, this is the way things are, this is the way we run things in the community. And I say this to say that, so a critical skill that we have learned on the field is negotiation and sort of agility and also flexibility, because if we had just started a combative argument with that social worker, then maybe the whole thing would have been dead. With the community leader, sorry, maybe the whole thing would have been dead because he is the community leader. So we now had to speak with him. I had to speak with him, pull him aside, try to negotiate with him and say, last time when we did this outreach, we did not give the children. If we didn't give the children, this can happen when they grow up. Just try to essentially, give him the full picture. And then we're able to reach a compromise. So he said, okay, if that's the case, he will be the one to choose the people. I said, fine, okay, you be the one to choose, but at least you're following our model. So, part of the things we see on the field is, that ability to negotiate and also be flexible and agile. Like things are not always going to go the way you want them to go. But then, it's always important to be focused on the mission and so on. So that's one part. The other part as well is infrastructure. Really, infrastructure is quite a challenge for us and just in Nigeria in general, especially in the rural communities, right? And rural communities are most often the last to receive certain infrastructure because generally you want to concentrate on urban areas where you receive more return on your investments, And so things like, connectivity in some instances, electricity, even as basic as electricity. So last year we had a program with the National Health Insurance Authority of Nigeria. And maybe I'll come to that maybe in another question. But essentially, we've seen the need to go from just reactive care helpline help, but also evolve that and complement that with sustainable initiatives. So put people on insurance so that they don't always have to come back every time for a 1K type of help. They can be empowered to, So when we were trying to do the process of registration, we went to a community in Niger State, Garam. And the team and my team are, tech savvy young people trying to use technology to solve or to administer the registration. And then we found out that, not everybody there is literate. Not everybody there is literate. Not everybody there can use, the phone. So we had to, and then also even the system at the time. So we had to use manual paper, write people's name, write people's details and so on. So in a perfect world, everything is interconnected. You can just press a button and go on, but it's not a perfect world. So I think the main answer I would say is just that ability to be flexible, to be agile, and to focus on what you're trying to do, which is to ensure that people have equitable access
Thank you so
to
much for
healthcare.
saying that. I think this it spotlights the theme of this podcast system series, right? Because
Yes,
we really can't innovate around not being true to ourselves about the limitations we have. And that's something I
correct.
was telling myself a couple of days ago. I was telling myself that, isn't it? You cannot solve the problem of bad leadership. You cannot solve the problem of the fact that you have, certain things the way they are. You just have to accept them as what they are. Until maybe when you get there, you can change it. But I really love the fact that you spotlighted some of these gaps, infrastructure, as little as literacy, power, and how they impact the work we do in healthcare. I think this is something that we need to be very true to ourselves. I'm going to solve for help the government. I'm not doing this from a place of profit, but these are the limitations I'm probably going to face. And how am I going to innovate around that? And this is what your team have done, even just taking from the paper. Because oftentimes people say, I want to launch an app, I want to do this. But
Yeah.
the truth is, the people that need this help, They don't
Yes.
need this. They actually have some
It's
systemic
very
barriers.
big. Yes.
Yeah, it's
Yes.
very basic they need to actually get
Yeah.
to. And I really love the fact that you mentioned that innovating around the system, innovating around the problem, innovating around the infrastructural gaps, and that's what I'm curious to hear more about your, partnerships and collaboration. I think you already spotlighted one with NHIA. So
Yeah.
what would a typical GivingSphere charity want to see in such collaborations and partnerships, even as we
Mm,
move the cost of moving Nigeria from that very low insurance coverage? So
mm.
how I
Yeah.
love the fact that you're already doing this, but how do you want this to look like? What's the typical ideal dream for you in terms of like
Mm.
collaborations and with other some organizations that might not even be NHIA?
Yes, no, I mean, so many dreams, honestly. But I would say the NHIA one is something we piloted last year and we want to scale it. And I say this because we found that, every time we help one person or we help a family through an individual. But then maybe there are other members of the family that need help. And so are they always going to come back every time? Or maybe that person today has, I don't know, malaria and they cannot treat themselves and then they are healed from the malaria because of the support. And then next month they have something. There's always that return of people coming back. And then we said, we need to make this sustainable. We have always had it at the forefront that we need to sort of make it sustainable for people. And that's where the insurance coverage came. And it may interest you to know that in Nigeria, 70% of people pay for healthcare out of pocket. So even though the National Health Insurance Scheme exists, not a lot of people know about it. Actually, through the initiative, a lot of people were like, oh, this exists. It actually works. It exists. It works, but not a lot of people know. And that's why our work also lies at the intersection of healthcare and poverty, because we also say in Nigeria, like you are one ailment, someone is one ailment away from bankruptcy because maybe today, you are not low income or you are not, on the lower end of the spectrum, but, or of the financial spectrum, but, somebody can have a terminal illness today and they have to sell their property and all their life savings to get treatment. So that's
So
how the
true.
intersection, yeah, that's how they intersect. And so this partnership was very instrumental and it was a pilot and we wanted to also see how it would go end to end. So we had it in December. That was our December outreach. And part of it we're told is it could take some time for them to get the cards and finally use it. So we wanted to know, wanted to have some monitoring and evaluation in that program before we scale it. But ultimately, I think there is a need to scale it so people are, empowered, to have healthcare access and so on. So that's one partnership that we want to scale. But I also see a lot of opportunity for partnership with, financial tech companies like fintech companies, where the likes of I don't know if I can mention the names of the likes of the Flutter Waves and the Piggy Vest, to have this to address the contribution and the donation aspect of it, but also making it very transparent and traceable, so people can have that comfort that I am, making donations to this cause and this is how the money is, judiciously used. So,
Mm,
I dream of a situation where people can, as they make payments in their bank applications, they can also easily donate through that bank application and getting an instant impact report of what their funds have been used for. So those are the type of collaborations. And also, with other charity, because I think it's an African proverb that says, if you want to go fast, go alone. But if you want to go far, go together. And, our real work is really to ensure that everybody in Nigeria has access to healthcare, irrespective of their financial status. So if that requires collaborating with a lot of more other charity organizations, I'm very open to that. We've already done collaborations with some and reached out to some. So yeah, I'm very open to those type of collaborations.
yes, I really, really appreciate what I'm just speechless. I'm just like, what? I
Yeah.
see the vision, I see the energy, I see your
Yeah.
whys, I see your heart, for lack of a better word. Definitely, it's very, very, but collaboration has been something I've been preaching for the last 2 months. Collaboration, collaborate. We need to improve that
Mm,
culture of collaboration.
mm,
The main aim is the patient life. I know you're trying to protect your organization, you're trying to be the best, but don't forget why. And that's why we started with your why, right? Why are you doing this? Why are you
mm,
exactly, trying to solve for this problem? And really, really love how you've told the story of your partnership with NHI. I'm sure you'll do more, as we take this to scale, right, to help, patients. Because right now, I think there is a demand for local, we have another podcast called Local Leadership. There is a demand for local people, local leaders who are going to take charge in terms of like charity and philanthropic work for healthcare. I think what you're doing is phenomenal. And I really, really want to call on all people who are going to listen to this to reach out to Isimeme for collaboration and, just supporting what she's doing, even through your funds, your network, or, basically, because there is a very clear need for this. Honestly, your 1,000 naira can actually save someone's life.
Yeah.
We need to keep telling this story so people can be aware of it. You mentioned something about partnership with fintech. I think it's also something very powerful because we are now seeing a lot of innovations coming in that space, like health wallets,
Yeah.
health within apps, right? Okay, donate for your health, but I really don't know how that culture is, but it's a new concept that people are now beginning to see that, okay, maybe I should save 1% of my income, right? And health insurance companies currently right now, they already do that with corporate. So I don't know if you have
Yeah.
any thoughts about the informal sector, right? How, this is a system series, right? Informal sector, like people who don't have a 9 to 5 job, who are entrepreneurs trying to survive and all. How I know it might not be a question you're ready for right now, but
Yeah.
how do you see that working in terms of like even that culture of donating for their own personal health beyond even before they start thinking about another person?
Yeah, I mean, so part of what we did when we had the NHI outreach actually was, we had some of the officers from the NHI to actually educate the people on insurance and what we're trying to do. So that's just one very, very low hanging fruit example of how part of our work is also education and advocacy, right?
Yeah,
Ensuring that people understand why and know what and so on and so forth.
yeah.
I think, a lot of education and sensitization around it will help people, see the bigger picture and see how their contribution can make a change. And if we have, a very clear, sort of clear, transparent red thread of,
Mhm,
how your income, however little, can make a change in someone's life or give somebody a fighting chance. I think
mhm.
that will motivate a lot of people. And
Yeah.
then when we think about also the informal sector or the unbanked, I think and because this is about system series, right? I think when we think about innovation in this space, we need to think about low bandwidth, type of innovation, right?
Mm,
You know, applications that can work offline, for example,
yeah.
just taking into consideration that, maybe electricity is a challenge and then, or internet connectivity is a challenge and then people can have applications that work online, offline. So, I think there should be a certain level of consciousness around designing with people in
Yeah.
mind or the situation
Absolutely.
in mind. Yeah.
I was about
Yeah.
to say clock it, because you also talked about human-centered design, and it's also very important because you have
Yeah.
to not just innovate around that. You have to think about the people who are using what you're
Yeah.
trying to build for, and we
So
really
maybe
need.
even SMS, USSD type of, I mean, just designing for the people in mind.
Absolutely, absolutely. Thank you, Simeme. This has been really great to learn more about what GivingSphere is doing. So we're going to wrap up with this question. If you look ahead, right, about the future of healthcare assets and medical aid in
Mm,
Nigeria and across Africa, what are the biggest opportunities for, people to come in, especially in these
mm.
times, right? What would you say if you look into the camera right now to look at somebody like you who is in telecommunication or maybe banking or maybe another industry? What would you say you would tell them are the opportunities to do good in this space?
I think there are a lot of opportunities, honestly. I think there are a lot of opportunities. I mentioned recently or just few minutes ago, a few seconds ago about this innovation with, the system in mind. So this low bandwidth type of innovation, I think that's really important for people in really deep rural communities that haven't had their connectivity expanded. So that's one area. I think there's also an opportunity for predictive and preventive health, sort of innovation around that, probably, but also the ability to use data from that. And I say that because you look at countries like Nigeria, where maybe malaria is, an illness that is recurring from when I was little. We've always heard about malaria using mosquito nets and things like that. So, or cholera, in certain countries in East Africa where it's really rife, there's a lot that you can do with technology to review the data over time, look at weather and temperature and historical analysis of what has happened in the past and, come into sort of predictive health and preventive health there. So rather than waiting for the disaster to happen, this is an opportunity to actually predict and prevent. So there is that. There's also the financial aspect, like we talked about, making it easy for people to give. Because one of the things, and maybe somehow that alluded to the name of GivingSphere, because we wanted to make it sort of easy for people to give, and not something, because everyone is inundated with so many other responsibilities. So yeah, there is that as well, the financial sector of it. And I think also, I mean, I really like what these people are doing in Rwanda. I don't know if you know about Zipline, where, it's using drone services to deliver medication to people in the deep rural communities, in minutes. I think there's a lot of opportunity there. When we did the outreach as well, we were in a rural community in Niger State, and we're hearing that the next hospital is about like 5 kilometers or 10 kilometers away. So someone who is even ill is not so incentivized to go and get care, because they have to think about maybe the transport cost of it and so on. So things like that, being able to make deliveries for medication. And I think Life Bank is doing that with blood as well. It's
Yeah.
super amazing. Yeah.
Actually needs to get Live Bank on the podcast. I've been chatting
Yeah.
with her for
Amazing.
I was
She's
definitely going to speak to her. Yeah, actually, like you just said something. Everyone has something to do in healthcare, and I think if Isimeme can do it, you can do it because she's not just managing teams; she's managing
Mm.
a lot of portfolio, different countries, but she still finds time to do this. I think I really, really, I'm amazed about how you've been able to pull this through, over the
Mm.
couple of years. And I really think that everyone, like you said, has something to do. The beautiful thing about healthcare is that we all have our health to protect, and the health of
Indeed.
our family members to protect, and the health of
Indeed.
our friends to protect. And so it's
Indeed.
something that we all have to face,
Yeah.
So
Yeah. I
thank you
just
for
wanted to add
like,
as well, like it's also so deep and layered because, part of what we have done and we do as well is, supporting when there are crises or emergencies.
mm,
So, in Nigeria, recently we had the Yelwata attack in Benue State, where there were these attacks and then people were moved to IDP camps. And,
yes,
you have the problem of, okay, there's been an attack, people have moved to IDP camps. But in those
yeah,
IDP camps, there are people who are pregnant, there are people who are ill, we had an outreach when that happened. We connected with, the community there, and we provided even just mosquito nets in the IDP camp, because sometimes you forget about this, right? You forget about some of those basic things, like if people in an IDP camp that is probably just, a tent or something, there are things like mosquito, like malaria. So we had to provide mosquito nets. We had to provide, um, mosquito creams, repellent creams, and so on to the people there. We also, went there and tried to support with some community workers there, and, tried to support. So sometimes we think about health about on the surface, but even like in the middle of crisis, there's still, that health aspect as well that we often maybe take for granted if we're not directly involved. Yeah.
actually. And it only makes sense to not just live for yourself, but to live for
Mm.
someone else. I think it's something that I'm taking away from this interaction with you today. Don't just think about yourself and think that, oh, I don't have the money, I don't have the means, I don't have the $1,000,000. Your 1,000 naira, your $2, $2, $100, $1,000 can actually save someone's life. So
Yeah.
thank you, Simeme. I we always
Thank
end our
you.
podcast with this, asking our guests, I'm sure that there are days where you feel like, oh, I don't want to do this anymore. This is becoming exhausting. Maybe you don't have those days because you're doing it with so much love or joy. But what is that principle or that quote that keeps you going, that makes you look back and say, I'm going to keep doing this?
Mm.
So, you think back, and it's a
Interesting.
reflective question.
Interesting. So I have two quotes
Mhm.
that sort of guide my life in generally. Actually, one that guides my general life, and then one that it struck me actually when I was in a moment of, oh, I'm not doing enough. I feel like there's so much to do with giving spare. So the first one is the life one, right? And it's a quote by an Australian poet, Erin Hansen, and it says, "There's freedom waiting for you on the breezes of the sky." And you
Mm,
ask yourself, what if I fall? And then the quote
mm,
goes on to say, but oh, my darling, what if you fly? And so, I mean, that quote stands out to me a lot because a lot of times when we want to do things, we think about the worst case scenario. Even with this GivingSphere, it's like, maybe I should have a website first. Maybe I should have a team first. Maybe, and then, you think about the worst case scenario and then you end up not doing it. But then what if you do
mm.
it and you actually do it well? So literally
Mm-hmm.
in everything I do, I always have a mindset of what if you fall? What if you fly rather? What if you actually
Right.
succeed? What if it actually goes even beyond your expectation? And so that's what makes me a bit sort of audacious in things. I can reach out and put my hand up and do things that are scary because at the back of my mind, I'm like, what if you fly? Right. And then the second one, which I just stumbled on in the middle of this charity work, is actually by Mother Teresa, which says, if you cannot feed 100 people, then feed just one.
Mm.
And, it sounds so, I don't know, however it sounds, but it's just some days where I feel like, oh, I mean, I wish we had enough money to be able to send everybody out of this hospital and help
Mm-hmm.
them pay their bills and so on. But you see the reaction of the one life that you're impacting, and it's
Mm-hmm.
like, that should keep you going. So that kind of keeps me going sometimes. I know the impact of one life, one sister, one mother, one daughter that we have helped, give a fighting chance or a fighting opportunity at life, irrespective of, their financial status. And so that one keeps, me and the team encouraged to do even more.
Wow. I feel like I don't know what to say because these two quotes are very heavy and
Yeah.
I'm like, they actually, I used to tell my guests, I'll probably hang all the quotes I receive on my wall. So like days where I feel so
Mm,
down, I'll go and say, this is what Isimeme said. This
yeah.
is the weight of the philosophy and also the principle behind it. If you
Yeah.
cannot feed 1,000, 100
Mm,
persons, just feed one person. I think
mm,
you've done that well. I really want
mm,
to commend you for the
mm,
consistency over the year. I don't think it's something that is easy, to do.
mm,
I'm sure you are using your personal funds you're using
mm.
your time, your skills to make this work. And I really want to commend you. I don't want you to stop. I want to see this
Thank
grow
you.
bigger and,
Yes.
better with more collaboration and happy to support you in this journey in any way I can. But
Mm,
definitely these two quotes are very, very powerful. And I think we need to spotlight them that if you can't feed 100 persons, then just feed one and just save one life, just save one person. And you don't have to wait for it to be big. Just a little fund, $1, $2, $10 can help save your life. So thank you, Simeme,
thank
for
you. Thank
sharing
you,
with
Zeme.
us.
Thank you
Yeah.
so
So
much.
we've come to the end of today's podcast. This has been a very, very interesting conversation. Today I'm with the founder of GivingSphere Charity, Isimeme Ughele. She's not just a founder, she's a telecommunication expert, a procurement expert, a supply chain expert, a
Mm,
life expert. She's an expert in she's a leader. Like she's not just doing this she's a leader in not just national, she's a global leader, leading a lot of countries in Middle East and across the world. So thank you so much, Isimeme. How can
thank
people
you.
reach out to you? How can people support the cause of Giving Sphere? Where do we
Mm.
find you? How do we support what you're doing if we have to?
Thank you so much. So on LinkedIn, I'm on LinkedIn. Isimeme Ughele is my name on LinkedIn. But then Giving Sphere Charity is also on LinkedIn. We have orange and yellow logo, so you can always orange and yellow color logo, so you can always find us. Also, we have a website, givingspherecharity.org. There you get to see so much more of, even our impact stories. And then we have a live donation link there as well, where you can donate and contribute if you're led to. And then also on Instagram, Giving Spare Charity on Instagram. So please, I'm very, very, first of all, I'm
Follow
very,
for
yes, please help follow us and just help us, scale this work. There's so much to be done. We've only just scratched the surface. And, in a country with 150 million people, there's really so much to be done. So thank you in advance for your contribution. I'm super grateful.
Thank you so much, Isimeme, for the work you're doing. I think it's very, very important that we continue to spotlight people like you.
Yeah.
And thank you for sharing, helping us to see the area of, the area of where we can fill in a gap, right? And also the role of digitization in supporting transparency and trust and how you've been able to do this even within your organization, right? I don't think you're just scratching the surface. I think you've done a lot of work, 1,500 lives. If you go to heaven and they clap for you, that's like a
Thank you.
So thank you so much for what you've done. And I'm really, really happy to have had you today on the podcast. Thank you,
Thanks to
everyone
you.
who are.
Thank you so much. I said it at the beginning. Honestly, you're doing so amazing. Well
Thank
done.
you.
Keep going.
Yes.
On days as well where you feel demotivated, just remember as well
I'll
that
go back to your
you're
quotes. Yes.
but also that you're inspiring a lot of people. So well done. And thank you for giving us this platform and opportunity to showcase our work. Thank you.
Absolutely. Thank you, Simeme. Thank you to everyone who's going to listen to this. I hope you learned one or two things. If you don't go with anything, just go with this that Isimeme started. You can take an action. And I really think that's what I'm going out with today. I'm going to have to listen to the quotes. Soaking, I already wrote down the quotes she
Mhm.
mentioned, but also maybe just end it. Say, there is freedom waiting for you on the bridges of the sky. And if you ask yourself, what if I fall? Ask yourself again, what if I fly? So thank you
Yeah.
so much for listening and thank you and have a great rest of your day. Bye. This is
Thank you.
HSB podcast series. We are spotlighting healthcare businesses all over the globe and helping you succeed in your healthcare business. Thank you and have a great day.